give everyone a chance to get on and get situated. For those of you that are joining us on LinkedIn, thanks for being with us today. If you're here with us on LinkedIn, go ahead and drop a note in the comments. Let us know where you're calling in from today. And if you're over on YouTube watching the live feed today, welcome and thank you for joining us. Please like and subscribe our YouTube channel. We share a video on there every week that talks about these actionable strategies that you can put into place into your business, start getting a handle on your healthcare costs. If you're with us on YouTube, also drop a note in the comments. Let us know where you're calling in from. We're happy to be on with you guys today. And today we're going to be pulling back the curtain on how the employers that we work with are turning rising healthcare costs into predictable savings. We know that it sounds challenging, but it's really not. Once you pull back the curtain and you get a good look at what's going on underneath the hood, you guys will see that it's really not that hard to take back ownership of your health insurance. So we're going to be sharing the system that our clients are using to flatten the curve, lower their costs, and get rid of those pesky renewal headaches. So I'm going to go ahead and dive in, guys. On today's call, we're going to be covering three main topics for you. We're going to talk about the hidden forces that are keeping your costs high. This is really what's underneath the hood and why you need to get a good look there. We want you to understand that there's some systemic challenges to the health insurance industry. The way that it's designed, unfortunately, is not in the employer or employee's favor. And we're going to talk about what that looks like. Additionally, we're going to talk about the top 3 levers that you can be using to drive down your costs. These are actionable strategies that you can walk away with today and start putting into practice in your organization so you can start to see some results. And then third thing that we're going to cover today is going to give you a real world example of one of our clients that saved $215,000 in their first year in working with us. We want you to see exactly how these principles apply and maybe how it could apply to your organization. So let's start off with what's really driving the overspend. And I call it overspend for a reason. Most employers feel it. They may know it. You may know that you're overspending, but you really don't know how to pinpoint it. And that's what we want to help you do, is we want to help you pinpoint where you might be overspending, because ultimately this is money that should be coming back to your bottom line. And think about that, from the perspective of our client that saved $215,000. Think about it from an HR standpoint or from a finance standpoint or really from any standpoint. What could your business do with an extra $215,000 on your bottom line? So let's look at how we could eliminate that overspend. And it really starts with knowing what's going on. So as I said earlier, the game is unfortunately rigged, and it's rigged in the carrier's favor. Carrier profits are up year after year. On average, they're trending up 4 to 5% in carrier profit growth on an annual basis, and your renewals are trending up about 8 to 9% on average on an annual basis. But unfortunately, the employees, they're the ones who really get the short end of the stick in this whole system because their wages are playing catch up. So as carrier profits go up, as premiums increase, employee wage growth is only going up at about 3 to 4% annually. And this leaves employees feeling the pinch when it comes to whether you have to shift the costs to the employees or whether you eat the costs. It still somehow always seems to end up costing the employee more, whether it's on the premiums or the deductibles or the coinsurance. And if we look at carrier profits from where they were a decade ago, and why I say a decade ago, because around 2013 is really when companies in my industry, I should say, started tracking the carrier profits. They were about 16 to 18 billion in 2013. Fast forward to 2020, they peaked at about 31 billion. And that was largely due to a lot of treatment being sought during COVID. And then in 2024, they settled around 25 billion. So significant growth in carrier profits. And these costs, they're not accidental. It's designed this way, as I said earlier. These are manufactured costs. So the system's working exactly how it is designed to work. And a lot of people in our industry will look at it and say, well, it's a broken system. Well, it depends on what side of the system you're on, right? The system's working exactly how it was designed, but employers are stuck in this loop of inflation while carriers and consultants profit. So if we look at this chart here on the right, this is pretty eye-opening as well. We can see that going all the way back to 1999, we have the average annual premiums for single coverage and family coverage. Single coverage, this blue line down here. Average annual premiums 25 years ago, $2,100. Fast forward to today, and that number is over $8,500 for average annual premium for an individual. And that's just average. A lot of companies are paying more than that $8,500 annually for individual coverage. And then it's a whole nother story when we look at the family coverage. That's gone from $5,700 all the way up to north of $25,000. So when you think about that, that's just for a family of 4 or maybe even a family of 3, unfortunately. $25,000, roughly $2,000 a month. That's the cost of a house, right? So these are manufactured costs. While healthcare costs continue to outpace wage and inflation numbers, it's creating an unsustainable burden for employers and employees alike. So let's look at the business model here. The profit growth that we've seen with insurance carriers over the last decade is driven primarily by premium expansion, not margin increases. And what I mean by that is their margins aren't getting any better because a large majority of the carrier-owned business is regulated by the Affordable Care Act, and also inside of that, the medical loss ratio. So if you're not familiar with what the medical loss ratio or MLR is, it's essentially just a statute that says carriers' profits is limited to a loss ratio of 80-20 or 85-15, depending on the size of your group. So that means that for every dollar, for large groups, for every dollar of premium taken in, 85 cents of that has to go towards plan costs or plan improvements. That leaves 15 cents of margin for the carrier. So the carrier's margin is really limited, and their only way to increase profit is they can't increase their margins. They have to increase their revenue by driving more premiums. So that's why we see these costs go up 8 to 9% every year. And again, this is a further breakdown of those cost increases over the last several decades. But this time it actually looks at the cost share by the employer and the worker. So I think this is pretty eye-opening as well. So if we look at individual coverage back in 2000 being $2,400, the employer's contribution of that was $2,100. Again, this is an average. This is from the Kaiser Family Foundation. And the employee's contribution to that coverage was only $333. So if we fast forward, that number's grown over 4 times in the last 2.5 decades. To about $8,500 total, $7,500 for the employer and $1,300 for the employee. Again, wages and inflation not sustaining this. And then if we look at the family side of things, where the average cost of coverage back in the year 2000 was $6,400, with $4,800 coming from you, the employer, only $1,600 coming from the employee. Fast forward 2.5 decades, that number now being north of 25,000 guys. That's $19,000 on average being contributed to this cost for the employer. That is, if we go back a few decades, that's somebody's salary. Obviously, I know no longer are people able to sustain themselves on $20,000 a year, but that is a large number, guys. So this correlates directly with the stock price of the big 3 carriers. And when we talk about this, we're talking about the carriers that are controlling the market: Cigna, Elevance, Anthem, United Health Group. We look at this stock price. By no means would you call this a meteoric rise. You can see that I bookmarked dates going all the way back to March of 2010. And why March of 2010 is important is because that's when the ACA, the Affordable Care Act, that's actually when it was put into play. So about 15 years ago. And we can see that after the ACA was put into play, we just see a increase massively across the board for all 3 of these carriers. Whereas in the few decades prior, they were just chugging along, earning a reasonable income, reasonable profit. All of a sudden, enter the ACA and profits boom. Wait, I thought it was called the Affordable Care Act. So question for you guys that are on with me. I'm curious to know, drop a note in the comments. What do you guys think is driving carrier profits today? So how does a carrier go from, a stock price of $35 to a stock price of $335 in just 2.5 decades time? While your premiums are increasing, these carriers reporting record profits. So we got to think about, where is the carrier alignment in all of this? Is it to you, the employer? Is it to the members that they serve, or is it ultimately to the shareholder? I think these graphs give us that answer. So let's talk about where that profit's coming from. First place we got to look is at margins and spread pricing. So most major PPO networks are frequently paying 2.5, sometimes even up to 5 times what Medicare, the CMS, deems reasonable for Medicare patients. So to put that into perspective, let's say Medicare deems that $300 is reasonable for an MRI. There's a high likelihood that your health plan in a PPO network with PPO discounts is paying $1,200, $1,500, sometimes even up to $2,000 for that same MRI. So that's what we call their margin, right? And then when we look at PBMs, they're routinely marking up their costs through spread pricing and administrative layering, such as GPOs. If you're not familiar with the term GPOs, this is a kind of a nuance and a new technique that these carriers have been using to scurry profits away. And GPOs is simply a group purchasing organization. So these carriers are forming these group purchasing organizations. And guess what? Oftentimes these group purchasing organizations are headquartered not in the US, but in places like Switzerland, where United States laws don't apply to them, owned by carriers here in the US. And these GPOs are used to negotiate drug prices, quote unquote, on your behalf. So I don't know if you've been looking at the data or if you have access to your drug price data, but I got to tell you, the drugs aren't getting any cheaper. So I don't know how many favors the GPOs are doing. It's just another layer of administrative costs that are being built into our plans. Here's a quick example for pharmacy plans. So spread pricing has been exposed in multiple states recently. If you're paying any bit of attention, you can see that there's been some lawsuits brought against major carriers, one of them being United Health Group, primarily with Optum, their subsidiary, their PBM. And these are for fraud or fraudulent reimbursement policies where they're pocketing spread, charging more to you, the consumer, the employer, and the employee than they should. So now we have the FTC coming down on companies like UHC for antitrust practices due to how they're operating your health plan. And this has been big in the news all year long. So if you're not paying attention, I urge you to start looking at some of these lawsuits that are going on. And these same practices of embedding margin or spread pricing, they exist in stop loss, admin fees, shared saving programs. A lot of times they're just better hidden in employer-sponsored plans. So you have to know where to look for them. Another thing that's driving carrier profits, and this is a big one, is vertical integration. So a lot of us, if we're in, either manufacturing or construction, we're very familiar with our own supply chains and the different vendors that we use within those supply chains. So just simply think of vertical integration as one parent company being over all the other vendors that you work with. So, for example, if you had all of your materials, all of your nails, all of your lumber, all of your materials that you need to run a job site, and they're all coming from one source, one location. Well, that's vertical integration at its finest. And what's happening is that a lot of these carriers that we see today are buying up their own entities to build into the supply chain. So whether it's the PBM, the TPA, the network, provider groups, GPOs, this is vertical integration, and it's happening right under your nose inside of your health plan. So while a carrier may be limited to how much they can profit on your health premiums with the medical loss ratio, they're not necessarily limited to how much they can profit from your pharmacy spend or from your network fees. Or from your providers, right? So this is how they're extracting more and more profit out of our health plans today. So this means that they're profiting both on the premium side and the claim side. Optum, as I just mentioned earlier, is a great example of this. They generate more revenue through the PBM in total than UHC's own insurance arm does. So remember, it was the insurance that started it all, and then they purchased and created their own PBM, and Optum's PBM is generating extremely more revenue than their own insurance plans. Okay, so that's just one example of vertical integration, and I can dive into more of that later if you're interested in learning how that works. And then a third factor here is misaligned incentives. And I'm specifically calling out misaligned broker incentives on this because I think this is something that everybody should be aware of. But many brokers receive override commissions and bonuses tied to carrier retention or premium volume. So what that would look like is, you have a lot of your big shops out there may have or claim to have great relationships with a carrier. Well, usually when they have a great relationship with a carrier, what that means is they place a lot of business with that carrier, so they become a premier shop for that carrier. And in turn, that carrier turns around and incentivizes them to place more business with them. So really, this is where the conflict of interest arises, because now they're bonused by retaining clients or by how much premium they place with them throughout the year. So this may not be directly reflected in your relationship with them, but it has an indirect impact that you need to be aware of, because what it creates is it creates a misalignment where, as a broker, I may be a little more inclined to recommend or place business or retain business or keep you stuck with a certain carrier. I may say something along the lines of, yeah, we looked at all the carriers. This carrier is still offering the best offer out there, even though we know we could get you a better deal somewhere else. So that's a real dirty little secret that you should be aware of. And these payments, they're often not disclosed to you, the employer, even though that with the CAA, the Consolidated Appropriations Act from 2021, the transparency rules are tightening up. So today, you're well within your rights to ask your broker for a compensation disclosure, for them to show you all forms of compensation, not just their commissions, but also whatever overrides they receive or bonuses they receive, trips that they receive. These things all go into shaping how your broker informs you of your strategy, your options, etc. And then the last one, and this is a big one that I want you guys to be aware of, is that broker compensation structures oftentimes create this perverse incentive where if a broker for your health plan is paid on commission, and let's just use a simple example here. Let's say I have a client with $1 million premium annually and I'm paid a 5% commission. Well, that's $50,000 in commission. Now, when I get your renewal next year and that renewal goes up 9%, or let's say for easy math, let's say 10% and goes up to 1.1 million. Well, all of a sudden, I just received a $5,000 raise and your costs went up. I didn't do anything other than just suggest that you renew with the same carrier and say, yeah, 10%, it's trend, it's inflation, medical trend, whatever they equate that to. And then you end up paying more while your broker earns more. Again, complete misalignment. So I encourage everybody on this call to, number one, know how your broker is compensated, because this a lot of times will inform the strategy that they will deliver to you. So knowing how your broker is compensated is super important in your relationship with them. And then if they are compensated in a commission-based arrangement, you can ask them, would they be open to a fee arrangement as opposed to a commission-based arrangement, where the fee arrangement aligns much better with what you're trying to accomplish. Then your broker's not getting a pay increase every time your costs go up. So guys, here's another really cool tactic that you can take that I want you guys to think of as well. I've seen this. I've had this happen with clients before. I have a lot of other colleagues in the industry that do it this way. But what if your broker's compensation was tied to your plan's performance? What if you could truly align your goals, i.e. saving costs, lowering costs, with how your broker is compensated? So instead of your broker earning more as your premiums rise, what if your broker earned more if your premiums decreased? So the way that would work is you have a flat fee arrangement with your broker. You pay them a flat fee for their services. In addition, incentivize them to earn bonuses by lowering your costs. This could be tied to your total spend. It could be tied to your per employee per year spend. It could be tied to your RX spend. Whatever's really your goal to drive that year is how you could structure that. The problem with most broker compensation is that it's disconnected in total from your actual savings, and their commissions, again, are based on your premiums, not the value that they deliver. So you want to understand, what are you getting in return for that hefty fee that you're paying your broker? And here's a big problem with most people's strategies today. Most people say, I talk to clients all the time. I talk to prospects all the time. And they say, hey, yeah, we used to go to market, or we're going to market. And going to market to a prospective client means that, their strategy is to go out and shop the market, right? Well, building a health plan, guys, it's not like getting groceries. Like, you don't go out and check the prices on the shelf, find the one that best suits you, and then pick them. And that's what most companies do, unfortunately. They'll go to market, they'll get 3 to 5 quotes, they'll choose a plan. And a lot of times, let's be honest, you're choosing the least bad option out of the options presented to you. Then you're going to renew. You're going to accept an inevitable premium increase. Hey, maybe this year we only got a 7% increase. That's great. That's not a win. And then you repeat that same cycle over and over again. Today, in today's market, you have to put a lot more strategy and thought into how you approach building your health plan than you have in the years past. And it's for the simple reasons that I just showed you earlier. These carrier profits are not getting any lower, and your costs aren't going down by chance. So getting quotes does not equate to having a strategy, guys. And I really hope that one lands with you guys today. This is a cycle. It's reactive. It keeps you stuck, right? A lot of employers think, I'll look at it when renewal comes. Or, we don't usually look at our health plan until 90 or 120 days prior to renewal. By then, it's already too late, because the underwriters already got your data. They already know where they're going to price you at, and they're just waiting to formalize it and send it to you. So you need to get a handle on this by looking at your data on a regular basis. And we're going to talk about that in just a little bit and give you some pointers on what to be looking for and what to be looking at. Another question you want to ask yourself is, do your goals align with your broker goals? So here's where I suggest that you start. I shared with you earlier how brokers are compensated. Start by verifying some of this. Start by verifying if the brokerage receives carrier bonuses. That's a very simple question to ask. And if so, are they bonus from your carrier? Second, ask if the brokerage receives overrides from the carrier. Verify if they do receive overrides, then verify if they receive overrides from your carrier. And then third, verify if your broker is paid via commission or via fees. If anybody's interested, you can drop me a note. I have a broker compensation disclosure that I'd be happy to share with you. You could get that, send it over to your broker. Just take a look and see how they're getting paid, and really start to understand where the misalignment in your plan is. That will give you a better idea of why your costs aren't going down. All right. And then the last thing that I want you to think about is the carriers that you work with. Okay. So the carriers, oftentimes, they give you this illusion of choice. So if you've ever seen, a United Health renewal, or a Cigna renewal, or an Anthem renewal, there's 75 pages on the renewal, and there's 100 different plans for you to choose from. They give you the illusion of choice. You want to control your costs, you have the option. Look over here, this cheaper plan, higher deductible, lower co-insurance, more cost shifted to the employees. That is not a choice. That's you being forced into making a tough decision and having to shift costs from your premiums to your employees. So as the employer, you pay the premiums, but in this relationship, the middleman, the broker, is not paid by you, they're paid by the carrier. And then it's the carrier who controls the entire ecosystem, or the supply chain, which we're going to continue to talk about today as well. So the carrier chooses your vendors. The carrier chooses your administrator. They choose your PBM. They choose your network. Why? Because they own all of those vendors. So when vendors pick each other, guys, you're losing leverage. This is not choice. It's just simply an illusion of choice. So let's shift gears and let's talk about what smart employers are doing today to win at containing costs. We're going to talk about the 3 forces behind predictable savings, and these are going to totally flip the script on how you operate your health plan and what costs you pay. So first things first, we're going to talk about risk management. Understanding your unique risk profile is so important in this equation. If you have no idea how risky your group is, it's going to be really hard for you to manage this spend. And let's be honest, we're talking about oftentimes one of your largest expenses as an employer. I know it's your number 2 people expense behind payroll, right? And for a lot of companies, depending on what other expenses you have, a lot of times this expense will land in your top 3 or top 5. So we're going to talk about risk management and how you can better understand your risk. We also want to highlight the need for vendor independence. So breaking free from that carrier-controlled ecosystem, literally, it's the only way you gain leverage. If you stay stuck in their system, you lose all your leverage. You give up all your leverage. So we need to talk about vendor independence. And then finally, making all these changes means nothing if we don't have performance oversight, if we don't have a way to manage, if we don't have something to manage towards, we're not going to be successful. So we're going to talk about performance oversight as well. These are the three forces that are going to put you back in control. So quick question for anybody that's interested in sharing, if you're on LinkedIn or YouTube, drop a message in the chat and let us know what performance metrics are you guys tracking. I'm curious to know as we lead into that section. So talking about force number one, knowing your risk. Without understanding your risk profile, guys, you're negotiating from a position of complete weakness. Today's top employers, they leverage ongoing risk analysis, sometimes including predictive analytics to gain the upper hand. So knowing your risk, knowing where your money is being spent, how much of your money is going towards medical, how much is going towards RX, and what the real cost drivers inside those buckets are, this is going to give you the upper hand. So it's important for you inside of knowing your risk to know how to read your claims data. First things first, let me back up. If you don't have access to claims data, how are you ever going to manage this spend? Just think about that for a second. It's like trying to balance a budget without the receipts. If all you have is the total spend, but not what got you to that total spend, there's nothing for you to do. And this is where a lot of carriers want to keep you. It's because they want to keep you in this stuck renewal cycle. So knowing your claims data and then utilizing that data to benchmark your medical and your pharmacy trends prior to your renewal hitting. This gives you an idea on whether or not you're running hot or if you're just being priced like it by the carrier. Second thing in knowing your risk, equally important, is mapping your chronic risk and your cost drivers. So you want to look for outliers. You want to look for cohorts of people, so to speak. So you can gain more visibility into what your major cost drivers are, whether it is chronic risk or whether it's pharmacy, and you want to have a game plan for what's already driving your costs. And then third, you want to forecast your large claim exposure. So early identification of your high cost claimants is going to give you a better indicator of what your renewal is going to look like. And it's going to allow you to not wait until your renewal hits to start to prepare your budget for the upcoming year. So here's some best practices when you're assessing your risk. So as I mentioned, you want to use your claims data. You want to spot your overspend early and also compare your performance to some similar employers. So this is where benchmarking comes in. One of the costs that we like to benchmark is per employee per month cost for chronic condition and specialty spends. This is an important one because this is easily benchmarkable. You can find this data from KFF, Kaiser Family Foundation, and it gives you an idea of what the national average looks like and how your plan compares to it. And you want to, again, look for any outliers here. Second thing you want to use to assess your risk is you want to look for cohorts, like I mentioned earlier. So use claims data to flag members with either diabetes, hypertension, asthma, segment these conditions by severity, segment these conditions by cost, and then also look for ways to engage these people in your population and start to put in place some preventative measures for this population. And then lastly, you may not know this, but this is one of the things that you absolutely have to understand is that a small portion of your population, only about 5% of your employees, are typically going to generate half of your medical or RX costs. So these are the either chronic users, chronic abusers, or people with just really high cost conditions. These large claimants are going to drive half of your overall spend. So you want to look at these claimants. You want to understand the conditions that they're facing. You want to understand the cost that goes into these conditions. This not only helps you put a plan in place to be proactive about what's driving your spend, but it also helps you better prepare for your renewal. I.e., if you have a $175,000 claimant on your plan, was this a one-time event or is this an ongoing cost that we're going to have to figure out how to continuously manage? So it lets you know how to better approach that piece of your risk. And unfortunately, most employers, guys, they never see their own claims data, literally flying blind or operating in the dark, lack of access to your data isn't an accident, it's a feature of the system. So a lot of times what you'll run into is you'll have a contractual barrier where carrier agreements deliberately limit your access to raw claims data. And a lot of times they'll just, chalk it up as this is proprietary information. This is why we can't share this with you. All they're trying to do is protect their pricing structure so nobody else finds out about it. This proprietary roadblock that comes up applies to PBMs, TPAs, where you have classified data that they're not willing to share with you. If you're in that type of relationship with a vendor partner, you have to get out. Absolutely unacceptable for you to not have access to your data on one of your second largest people expenses. And then the third challenge that we often see is that you're either going to get delayed access where you have to request it. How frustrating is it when you need something, you should be able to access it at your fingertips. So they're either going to delay and take weeks to deliver the report that you need, or even worse, they're going to make you pay for your own data. We just had a recent example of this, a client with a big name carrier, which I mentioned earlier. They're in a level funded program, which the reason they moved to a level funded program is so they can get access to data. But unfortunately, when they requested the data that we were going to review, the carrier then sent them 2 NDAs asking them to sign, telling them they couldn't share the data, which it's important to be able to share this data with potential new partners so they can reprice your data. And then the second thing they asked for is they asked for a check. They wanted the employer to pay for their own data in this situation. So, I almost lost it on the carrier, but, think about that. You mean you're telling me that I have to pay for access to my claims data just so I can see how much you're overcharging me? If that's not backwards, guys, I don't know what is. So you can't manage what you can't measure. If you're stuck in the dark, one of your first takeaways from today should be, how do we put ourselves in a position to get access to our claims data so we can start managing this spend? All right, and then let's look at force number 2. So smart employers know that in order to be successful, you have to create vendor independence. When all your vendors are answering to the carrier, again, you're going to lose leverage, right? They're going to set the pricing. They're going to set the costs. They're going to set the fees. These are what we call bundled vendors. They serve the carrier and not you. These are profit centers for the carrier. That's why these companies were acquired. That's why they exist in their supply chain. You want to look for vendors where you have a separate financial relationship between your vendor and your health plan. This leads to true accountability where your vendor reports to you, not the carrier. So this starts with unbundling your administrator, your TPA, your third-party administrator, or unbundling your PBM, your pharmacy benefit manager, or unbundling your network from the carrier. You want a customized stack that's going to be based on performance of the vendor, not packaging from the carrier. Think about it for a second. You don't bundle your own internal supply chain, whether you're in manufacturing or construction, so why do it with your health plan? When we look at best practices, just in general for businesses and managing the supply chain, utilizing independent sourcing, separating vendors from materials, quality control, and construction, or built-in oversight. Inspectors on the job don't report to the suppliers. This ensures objective verification. And then third, this provides clear accountability when you don't have bundled vendors in your system. So their performance metrics are tied to their specific roles, not the overall role of whoever's managing those vendors. And then you have the bundled health plan supply chain. So again, think about who we mentioned earlier, the big 3 carriers, single source control, one entity owns and manages all the vendors that it takes to supply healthcare to your employees. They have a self-review process. So they're literally their own checks and balances. And then you have these hidden conflicts, which we've called out a few of those today, where these financial incentives drive decisions in your health plan that don't end up in your favor. Independent sourcing isn't just for your materials. It's how you stop your overspend on your health plan. So again, don't let the carriers pick the team. When we look at the left side of the screen here, at least my left, might be your right, not really sure. We're looking at fully bundled insurance products that are carrier controlled. And guys, this is the same whether you're in a fully insured, level funded, or even in an ASO self-funded relationship with these big carriers out there. The carrier picks the team. It's their PBM, their network, their TPA, their stop loss. This leads to limited transparency, hidden fees, and built-in conflicts. All this leads to you losing or spending more than you should. What we want to do, or what we encourage our clients to do, is we want to disintermediate the supply chain. So your business sits at the top and you hire an independent pharmacy benefit manager that you pay directly. You hire direct stop loss. You hire a TPA that reports to you, that provides you ultimate value in managing your health plan spend. And the right TPA is a game changer, but the same could be said for your PBM and your stop loss as well. And then lastly, you can look at custom network options. This is becoming hugely popular in today's market for controlling costs. This all leads to full transparency from your vendors. You get to see how much they're paid. You get to see how they're paid. You get to see what you're paying for claims, what you're paying for your drugs. And this gives you aligned incentives and maximum control over your health plan, guys. Here's a simple case for vendor independence. This is a $420,000 lesson in pharmacy spread that unfortunately one of our clients had to learn the hard way. So, one of the things that we often talk to our clients about is, how do you get from point A to point B? And you can't necessarily just say with a wave of a magic wand, hey, I want to be self-funded and have ultimate control and save $400,000 on my health plan. It just doesn't work like that. You want to stair step your way into these types of arrangements, because there's a lot of layers that you have to peel back in order to gain control. And that's ultimately why we designed a blueprint to help you get there faster. But in this client's case, one of their first goals was to get access to claims data. They were fully insured for decades. They had over 120, 150 people in their health plan at the time. And when we moved them from a fully insured plan to a level funded plan, we finally got access to data, and we could see where their money was going. And we could see that of their $1.2, $1.3 million spend, $420,000 of that was going to just 3 drugs on their plan. They were paying $35,000 a month for 3 specialty medications. When we did some more investigation, turns out that only $20,000 of that was going to the pharmacy every month. $14,700 of that was being pocketed by the PBM in the form of rebates and spread pricing. So this is $176,000 in rebates and spread that we were uncovering. And this did not include administrative fees that the PBM was paid to run the plan for. Guys, this isn't a one-off. This is happening to employers all over the country, everywhere. And it can be really detrimental to your health plan if you don't know what to do about it. And then the third and final force is performance oversight. So as I mentioned earlier, knowing your risk, having access to your data, knowing what to look for, knowing how to create independent vendor relationships, none of that matters if you don't know how to manage this, right? So again, one of the things that I'll always stand by is what gets measured gets managed, and what doesn't bleeds budgets. So how do you put in place an ongoing monitoring system to keep your costs aligned with your performance? Well, I want to share a little insight into that. So number one, turning your claims data into a strategic advantage. This is the first thing that you want to do. Every quarter we meet with our clients and we dig deep into their plan performance. We don't just observe it, but we actually come up with actionable strategies out of these quarterly meetings. So by using data-driven analysis, we can analyze claims data to spot some of these outliers or cost spikes, to spot the chronic conditions, and to spot any trend shifts. So, whether your per member per month cost goes through the roof on your pharmacy, or whether your per member per month utilization is high on the ER, these are trend shifts that we want to be aware of and we want to be looking for. And so this is one of the things that we do in our quarterly meetings with our clients. And then another thing that we highly encourage is a vendor alignment check. So hugely important if you have independent vendors is to understand all the value that the vendor is going to be able to bring to you, or where the vendor may be misaligned with your needs. So one of the tools that we use in these quarterly evaluations is called a vendor evaluation scorecard. So if we have an independent PBM or an independent TPA, we look to them for answers. We ask them the tough questions. Things like, how are you compensated? What fees have you disclosed? What fees have you not disclosed? What strategies do you use to keep our costs in check? And we have a whole checklist for this. So for anybody who's on today's call, if you want to get access to that vendor evaluation scorecard, you can shoot me a note on LinkedIn or drop me an email. I'll be happy to share that with you as well. And then finally, this all leads up to proactive intervention. So it's the quarterly meetings that put us in a place of control prior to ever getting our renewal from the carrier. By the time we get our renewal from the carrier, we already know what our next 3 moves are going to be. We already know what direction we're going to shift this year to gain control of those costs that we were just evaluating. It's exactly how we caught that $420,000 in pharmacy spread that we mentioned earlier. It wasn't luck, guys. It's part of our process. And remember, this oversight, it's not a formality. It's how smart companies manage their health plan today. Think about it again, comparing it to your own business. You wouldn't skip vendor insight in your core business. So why would you do it with your health plan? Core business principles where oversight is non-negotiable. You're going to review subcontractor bids. You're going to audit your material costs, your supplier performance. You're going to track equipment downtime, waste, or labor efficiency. And then when it comes to your health plan, oftentimes what most employers do is they just pay the bill every month and they wait till the renewal. You have this complete missing side of oversight from your health plan where you hand over millions of dollars without ever knowing where your money's going or how much spread pricing is involved in that or how much markups you're paying for. And this all ultimately is because of conflicts of interest hidden in your plan that you're unaware of. So this is where vendor oversight really is key, guys. And having independent vendors allows you ultimate control over those vendors. Again, without expectations, without performance oversight, none of this really works. So here's some key numbers to know in your own health plan. Oftentimes we suggest that our clients shoot for a greater than 85% generic fill rate. Why? Well, because most drugs on the market today have generics available, and oftentimes formularies for bigger PBMs will lean towards pushing tier 2 or tier 3 drugs because there's a higher rebate, even though a generic could handle the same condition that member is being treated for. So you want to shoot for an 85% or greater generic fill rate. That could be your target. Industry averages between 82 and 85%. And with a lot of low performing plans, we'll see less than 75%. And then you want to look at your per member per month trend. This could be another good one for you to manage. So maybe you want to set your goal at $800 in total per member per month spend. This is a spend that is only looking not at your premiums, but at your medical spend and your RX claim spend, okay? So per member per month, medical and RX benchmark, $800. If you have a really high risk plan, this cost can exceed $1,200. If you have a really great plan designed with aggressive cost containment, these costs can come down to $600. And then another good one to look for, this is a high cost outlier in your plan as well, is your ER visits. So you want to shoot for a benchmark of under 120 ER visits per 1,000 members annually. So a lot of health plans will give that data to you. I was actually just looking at a client today that had 33 ER visits per 1,000 members. So this is extremely well performing. This client has put in place things like no cost doctor's appointments, no cost urgent care, no cost labs, no cost imaging. So they're driving their employees to these lower cost providers by offering this care at no cost. And it allows the employees to get the care that they need and not be forced in a situation where you have these chronic abusers who go to emergency rooms every time they need care, right? So that's another good one to put in your benchmark. So some key takeaways from performance oversight in action. Again, oversight is not optional, guys. It's a strategic advantage. It's what puts you in the driver's seat. Demanding accountability from your vendors is key. You do it in every other part of your business, so start doing it in your health plan. Number 2, set up quarterly reviews with your broker to uncover what others miss or what your carrier is not going to point out to you. This is where you identify misaligned vendors, cost spikes, trend shifts before they spiral into wrecking your budget. And then number 3, key takeaway here is action beats observation. Again, data is only useful if it drives action. We don't just sit here and look at this quarterly claims data and say it is what it is. Claims are just claims. They are not. This is one of the biggest falsehoods I've ever heard. I've heard brokers say it, claims are claims. Well, they're not, guys. I'm here to tell you that claims are what drive the majority of your spend. And, claims are just claims. Could mean that, there's nothing that you could do about your employees getting sick or where they seek treatment. And this is totally false. So top employers today are taking massive action using predictive analytics to know what portion of their population needs their focus. They're partnering with care navigators or nurse navigators that do proactive outreach to that portion of their population to ensure that those people are getting the treatment that they need before their conditions spiral into a problem. Guys, there's a lot of things that you can do to drive down the cost of your claims. This is why these meetings are so important, that you have this quarterly review process in place. All right, so let's finish up today with a real client example of kind of how one of our clients walked through our blueprint to put them back in control. So let's look at how one employer saved $215,000 in their first year alone using these exact levers. So here's a little bit of backstory. This is a manufacturing company out of Dallas, Texas, just outside of Dallas, actually. They manufacture computer chip boards. And when we first met this company, they were a lean operation. They had 30 employees on a standard fully insured plan, very limited visibility into any data. And then they had a basic broker relationship where they were paying their broker a percentage of commission. Fast forward a few years, they won a big contract and their workforce surged to over 300 employees. During that growth, their benefit strategy and their approach to benefits stayed the same. So fast forward, the company's grown 10x, and now all of a sudden they have the same outdated approach to benefits, the same basic broker relationship, and the same lack of visibility into their mounting costs. So they had an oversight gap is what they had. They had no visibility, they had no strategy, and that's when we entered the relationship. So here's their turning point. Company that I'm talking about is called Salcomp Manufacturing. And after being fed up with year after year cost increases with Blue Cross Blue Shield of Texas, we met with them for a discovery call, and our benefit cost containment consult was the first revelation to them that they were paying a 5% commission to their broker on a total of a $1.5 million spend. So in reality, they were paying $75,000 in broker commissions without access to data or any performance metric. This is what we call extraction, not consulting, guys. $75,000 for a fully insured plan is just a complete ripoff. And so their response was, well, what do we do? Well, this is where we introduced our benefit cost containment blueprint, and we showed them how they could strategically make small moves over time that would lead to great savings for them. And they started to implement this system when we first started working with them. So in year one, they went from a blind spend to about $215,000 in savings. So before, they were fully insured with no access to claims data, paid 5% commission on that $1.5 million spend, had no accountability from either their carrier or their broker. After we moved into a level funded plan, they got full access to their claims data. When they were working with us, they were paying a transparent $40 PEPM consulting fee. So no longer were they paying a commission that was based on how much premiums they were paying. And then they started to get clear visibility into their cost drivers. This move alone, just underwriting their plan and lowering their consultant fees, saved them $215,000. And it was this move that gave us access to data. So in year one, we saved them $215,000 while they grew 275%. And in year two, we were able to finally uncover their pharmacy overspend, and we were able to save them $195,000. So this is a company that was paying $420,000 a year on just 3 specialty drugs. They had no visibility into their spread pricing or rebates, and the PBM was pocketing the difference. So at this point, they said, well, how do we fix this? And the unfortunate answer is if you're with a major carrier, there's no way to fix that. There's nothing you can do. You're locked into their contract, their prices. The only way to fix this is to move outside of the carrier system and to start working with independent vendors, which is exactly what this client did. So they moved to an independent PBM and TPA, and their net drug cost dropped by close to $250,000. The rebates were passed back to them. The spread pricing was eliminated. The benefits did not change. just smarter sourcing. So they went from a carrier-controlled spend of about $420,000 to an independent PBM controlled spend of about $220,000. So in year 2, this company saved another $195,000 in pharmacy savings and gained even greater control over their health plan. The pharmacy savings was just a start because also they were able to implement direct contracts with providers for things like surgeries, labs, and imaging, which allowed them to then implement zero-cost procedures for their employees because they were paying such a lower rate for these common procedures. So not only did they lower their spend, but they actually improved their benefits in year 2 as well. So here's everything that changed. So before, they were fully insured in a carrier bundle, carrier-owned PBM. They had an annual renewal scramble. They were only getting their renewal about 60 days prior to the time that their plan actually renewed, no data visibility, and they were ultimately stuck in this cycle of reactive decision-making. After we moved them to an unbundled vendor stack, direct-to-employer bundled surgery model, carved out their PBM, implemented a renewal operating system, which I mentioned is the benefit cost containment blueprint, gave them a real-time performance dashboard, and put in place a strategic multi-year plan that we call the benefits roadmap. It's a 3 to 5 year roadmap of all the decisions that they already plan to make to continue to control their costs. So that is the story of Salcomp Manufacturing. We've loved working with them over the years. And this is what long-term control looks like for them. So this is national average here on the per employee per year cost. When we started working with them, it was $11,450. We got their per employee per year cost down to $9,800. In 2023, national average was $12,250, and in 2024, the national average is $13,108 for per employee per year costs. And you can see Salcomp is trending at a much lower rate and still well below the national average in 2024. This all happened through the use of the benefit cost containment benefit cost containment blueprint, where we gave them playbooks, scorecards, and strategy cycles to help them with their quarterly reviews, vendor evaluations, designing their strategy, and knowing how to understand their risk reports. So for anybody who's on today's call, if you're interested in knowing how this might apply to you, I encourage you guys to take the first step. Most companies on average save somewhere between 8 to 14% in their first year with our benefit cost containment blueprint. And we're going to go ahead and drop the link. If you want to book a call with me, this 30-minute call is simply a discovery call. It's where we look at your current setup. We'll take a look at what's working, what's not working. We'll look at your renewal history and identify any pain points that you have. After that, we'll provide you with our vendor evaluation scorecard so we can begin a vendor evaluation. And then we'll identify the key changes that you need to get back in control of your health plan. Guys, I've tried to keep this under an hour. I appreciate you all joining me today. It's been great to be able to share some of this strategy with you. I really look forward to having further conversations with anybody who's interested in lowering their costs and improving their benefits. Thanks so much for joining me, everyone. I hope you have a great rest of your day.